Dear friends, having discussed refractive errors in general and hyperopia in particular, now we come to the most romantic of refractive errors, myopia, something which we are very familiar with and most of us personally suffer from. If you check the refractive errors of most of you, it will be in the myopic side. Myopia, short sight, is very common refractive error. So what is happening here? What is happening is like the image is formed in front of the retina. Parallel rays of light when the accommodation is at rest are focused in front of the retina. And this can be because of a large eyeball. If you check the axial length of this eyeball, it can be beyond 24 millimeters, which is the normal. It can be 26 millimeters. Or the cornea can be very conical. Have you heard of keratoconus? Keratoconus patients will have myopia, and the reason is that the cornea is very conical. Similarly, a nuclear cataract. Patients can have a nuclear cataract. Yeah, cortical cataract is different, which has hyperopia, which we saw in the last PPT. Now we are going to see nuclear cataracts are mostly leading to myopic state. In fact, that is called second sight. Do you remember? You would have read about second sight in cataract, and just revise it here. It's an ideal time to revise that particular portion here. Understand that in a nuclear cataract, a myopia is induced. Then myopia can be due to excessive accommodation, spasm of accommodation. That is another big problem which we face nowadays. That's why most of the times your parents keep telling you, don't keep looking at the cell phone for a long time. Don't keep looking at the computer screen for a long time. This is because when you're looking at something very close to you for a very long time, say hours, you are playing a game or something, and it goes on for hours, then your accommodation, which has to exert to zoom into that game, will go for spasm and will not relax. Then after the game, you'll have splitting headache. There will be profound headache. You will have to be surprised why you have developed headache, and you'll have to go sleep off. If you sleep off, most of the times this headache will go off, but unnecessary for you to suffer a headache just because you have not properly kept the reading distance. So only we advise all people not to read in a traveling vehicle, or keep something very close to your read, or lying down and read. Not having the proper posture when you are reading something will lead to a lot of neck pain and headache because of these problems. Okay. The next interesting thing is most of these patients will have this kind of skewing of their eyes. What is skewing of the eyes? Skewing is half shutting their eyes. They'll look like they'll close their eye half and try to peer through that closed eyes to create that pinhole effect. This is called the pinhole effect. Please understand here that all refractive errors will improve with pinhole. If you use a pinhole, in fact, in clinical ward postings, they'll teach you pinhole. Pinhole will improve all refractive errors, and so a person reads 6/60, you put a pinhole in front of him. If he has a refractive error, he'll read 6/6. That kind of correction you will get with pinhole. Similarly, patient will have poor vision for a distance. You ask them to read something or see something close by, they'll be very comfortable. In fact, most of these myopes will be introverted people. They live to their own world, which is very small world. They bottle down to a small world, which they are very familiar with and very comfortable with. Distance is bit not seen by them properly. That kind of psychological state myopia pushes us to. So myopic eyeballs are usually big eyeballs, unlike hyperopic eyes. And myopic eyes usually has a nuclear cataract. And you see the nuclear cataract. And myopic eyes will also have lot of retinal manifestations. That is the problem. In hyperopia also, we saw about short silk retina and pseudohyperopia, but that is not a big issue. Usually, considering the relative severity of these conditions, myopic fundus changes are very severe and very dangerous. Why should that happen? Because The enlargement of the eyeball that happens in myopia, enlargement of the eyeball is more of the posterior segment. Beyond the equator, the eyeball grows more. The eyeball doesn't grow more in front. In fact, it grows more behind. And in that way, the retina gets stretched too much. The retina gets stretched too much. And because of the stretching of the retina, there is a lot of degeneration of the retina, choroid, and vitreous. Retina, choroid, and vitreous. In fact, when we study something about retinal detachment, we'll say all high myopic people are vulnerable for this kind of retinal detachment. And that is because of their state where they have a large eyeball where the retina is very stretched, and so it can develop small degenerative spots which can become a hole, and the patient can develop a retinal detachment. Okay, and so now we have come to a term called high myopia. What is this high myopia? High myopia or pathological myopia is a myopia which is above 6 diopters and which is usually genetically premeditated, genetically predestined. Usually the parents have high myopia and they have it, the children get it from their parents, and they also develop this kind of a high myopia. So because of this high myopia, pathological myopia, what are the retinal changes is an important question. The vitreous will be very syneretic or thin, liquefied vitreous. So remember that first, liquefied vitreous. Second, in the disc, you will see a temporal crescent. Temporal side of the disc, you will see a crescent. If you see the cup, it will be having a big cup disc ratio. It is called the C by D ratio. The cup disc ratio will be very high. In the macula, if you see closely, you will see faster fugue spots. In the retina as a whole, background retina, you will see tigroid fundus, tessellated fundus or tigroid fundus. Similarly, if you closely watch the choroid of these patients, they can have small cracks, and these cracks in the choroid are called the lacquer cracks. They are called the lacquer cracks. So certain times the eyeball can become so very big, it will start bulging, and it is called a posterior staphyloma. The eyeball will be bulging like a keratoconus, which is bulging in front in the cornea. The retina will be bulging behind in a posterior staphyloma. So these kind of changes occur in case of a high myopia, which is also called a pathological myopia. So what do you do for these patients? You correct them with concave lenses. Concave lenses are diverging lenses. So these lenses are also referred to colloquially as the minus lenses. These minus lenses are given to the patient. Once they are worn, the patient then has a power to focus the image perfectly on the retina and get corrected of his refractive error. So correction is usually spectacles with contact lenses, or contact lenses which are of minus order, like minus, concave. Okay, remember that. Similarly, these patients will go for a lot of refractive procedures, but all these refractive procedures are after 20 years, remember, because before 20 years, the refraction is not stabilized yet. So if you do a correction, then the stability will not be there. So you will end up burning your fingers, because the refractive error might change further after the correction. So you don't want that to be there. So you have to wait till 20 years of age, get to do a LASIK. Usually LASIK is done. Today, in the place of LASIK, we do another procedure called SMILE. Please remember SMILE. SMILE is done today. SMILE is done as a procedure for myopia. So this is the overview of the story of myopia. You can compare it with hyperopia and remember it. But I'll advise that amongst the refractive errors, myopia is a bigger and more common question. So please take special pains to understand myopia, and also the fundus changes of pathological myopia, because pathological myopia in itself might be a short note. So tell that it is genetically predetermined, and the babies have a large eyeball, the children have a large eyeball, and because of that large eyeball which keeps growing, they develop a lot of retinal changes, vitreous changes, choroid changes, and these kind of points, if you remember, it will be very good for you to answer them.